Good morning, everyone. Welcome to the Care Manager training and review. We're going to go over some of the changes that we've made to the Care Manager form in Care Manager for the CBHLs, and it'll also be used by the Youth Behavioral Health Liaisons too. So welcome. We will do this again on Monday. You are welcome to attend again on Monday if you'd like. I'm also recording this, so for those who can't attend, or if you would like to go back and review, that would be great too. Please let me know if you have any questions. Feel free to unmute or put them in the chat. I'll try to catch that. James, if you could help me watch the chat too, that would be great.
Sure.
And I will do a quick introduction. Of course, I'm Casey Rafferty with the council, working with the CBHLs. I'd like to introduce Michaela Youngmeyer Geiger. She will be working with the Youth Behavioral Health Liaisons. Would you like to say something, Michaela?
Yeah, good morning, everybody. I know that the CBHLs have been going on for a while now, and Casey's done a great job with that. But if you are a Youth Behavioral Health Liaison, welcome to the party of this. And we're super excited to have you. And I know that it'll be changing lives just like the CBHLs do. So thanks for being here today.
Thanks, Michaela. Tara, James, do we have anyone else? Would you like to speak up? Oh, Daisy's on too. Say hi, James.
Hi, I'm James Barber with the council. I monitor the chats.
And he doesn't like to use his camera.
Yeah, he doesn't like to use his camera. There's several of us that work on Care Manager and all of the data stuff. So we are the team behind the scenes usually. So always feel free to reach out if you have any questions about Care Manager or the data that we send out.
Thanks, Tara. Daisy?
Hello, sorry I'm a minute late.
Thanks for being here. Daisy will take care of most of any Care Manager Help Desk tickets that come in. So when you send an email to Care Manager Help Desk, she's usually the first one to see it and take care of it for you. Thanks for being here, guys.
Absolutely.
All right, I'm going to start first with just going over some of the changes, just as a reminder for everyone. Can you see that? Okay, see heads nodding, that's good. And I won't go over it line by line. If you were at the CBHL meeting in May, we went through this, but I just wanted to highlight some of the big changes that have been made. So in the fields that have been added or removed, we have added a field where you will enter your name, and that is searchable. So if you've already done this, as you start typing your name, you'll see that it'll auto-populate. And so then you just select your name from the list that comes up. We've added the optional field to indicate law enforcement agency or other school details after the referral source. So when you select referral source, say for example, you select municipal police, which we have always kept that very general, general categories because of the number of referral sources that you may have from different agencies, but now you can enter the actual name of the agency if you so choose. So if you select municipal police and it came from Jefferson City Police Department, then you can enter that in there. Or for the Youth Behavioral Health Liaisons, if it came from a school or other agency you want to indicate that name, that's where you would enter it. But it is optional, not required. We have changed county of residence to county of referral. So instead of indicating the county of where that client resides, because we can gather that from their address and their demographics, we've changed it to county of referral to indicate when you receive a referral from a county outside that may be different from that client's residence. Added date of actual contact, which is an optional field. So you will still enter attempted contact date. And then once you do make contact, you can enter that date of actual contact with that client. Obviously, if you aren't able to make contact, that can remain blank, and that's why it's optional. And then we also added date of referral to behavioral health services, and that will help us down as we track those individuals where we make referrals, the date that you make the referral, as we start looking at data feeds coming in from DMH, if that individual is engaged in services with a provider, then we can track that individual and see, you know, what date did you refer, when did they actually become engaged, how long they were engaged in services. So over the years, this will really help us tell a better story about what you're able to do to connect those individuals to services. We've added a field to reflect the work that the youth behavioral health liaisons will be doing. And we'll look at those when I get into care manager here in a minute. But one thing next to the name, when you type your name in, if you are a youth liaison, and I don't know, Michaela, do we have anyone on this morning? I'm not seeing, doesn't look like it.
Ashley Berry is a youth liaison with North Central. She's on.
Okay, great. Welcome, Ashley. We'll want to make sure, Casey, that you get that information to Michaela.
Yes.
And I'm also a youth behavioral health liaison as well. This is Beth.
Yes, hi, Beth. Thank you. Welcome. Thank you for both speaking up. We are very glad to have you here.
Yeah,
So
the
as
only
we-
one I don't see is Jason, but I'm sure he'll be attending on Monday.
Okay, great. So as you enter your name into that CBHL field, then you'll check the box that you are a youth behavioral health liaison, and that will allow us to filter those out. So several other changes, I won't go into all of them, but I do want to point out for those that you indicate are justice involved, and instead of just pending charges, you can mark it as pending charges or trial. So those that have already been charged, but they're just waiting their trial, that just incorporate. We had some that were coming through that really didn't match any other options. So we added that. And then under referral source, you will have we changed CMHL to CBHL. And then added another community liaison. So this would indicate the YBHL or a housing liaison, or in the future, if we have another community liaison program. So this is where you'll separate that out. If you receive a referral transferred to you from another CBHL, please mark that as CBHL, another CBHL. If it comes to you, no matter whether you're a CBHL or a youth behavioral health liaison, if that comes to you from another community liaison, like another youth or housing, then you would indicate that there. We want to keep those separate. Any questions on that? Does that make sense?
Casey, there is a question in the chat. Would a community navigator through the health department fall under this?
I think when we put this in, Tara, we were thinking that it would be another community liaison through a CMHC or, you know, one of your provider networks. Don't you think, Tara?
Yeah, that's what we were envisioning. I was looking at the other options though. So they have other, but I don't see like community, anything with community specifically.
Do we have other state agency?
We have state agency.
State agency. Okay.
Mm-hmm.
Didn't you say that was through, sorry, I can't see my chat with my sharing the screen. So was that through the health department, you said?
Yeah, community navigator through the health department.
Mm-hmm.
So maybe that would be more appropriate for the state agency. Or I guess that's local. So other.
Yeah. Okay. Any other questions? Okay. We revised date of referral to date that you received the referral. This goes back to what we were talking about, just making sure that the date that you enter is not the date that the referral was made. So if you're getting a referral that the was actually done a month ago, a week ago, 3 months ago, you're entering the date that you actually received that referral. And for those that are in the city of St. Louis and working with BHR, we did modify that a little bit. So once you indicate the referral source, you just mark that you received that referral from BHR. So please make sure that you're doing that, because that's how Tara and her team are able to filter out those referrals for BHR and report them back to them. So we replaced services referred, where you could only select one option, right, for services that you referred them to. So now you have the ability to select multiple options for the services referred, and we separated it. So you have behavioral health referrals, which is a required field, and the options are separated by mental health and substance use treatment. And this came from discussion among the group at the meeting and some other work group meetings to make sure that we're capturing a little more information on those services referred. And then also, if you, of course, if they're in custody, you can indicate that, or they refuse services if you're unable to locate them to actually provide referrals. And then also if you transferred to another liaison, and here you don't have to separate it. It can be any liaison. So if it's going from a CBHL to a youth behavioral health liaison, or vice versa, or another CBHL, you can just mark transferred to another liaison.
Casey, I have a question.
Mm-hmm.
So a lot of my clients are referred to detox, and it's not really inpatient or residential treatment, but I've been putting inpatient SUD treatment. Can we get that added, or do you just want me to continue to put that under inpatient? So there's two, because a lot of times I'll do, so withdrawal management.
That would be my first thought.
Okay.
Tara, do you?
Yeah, that's what that field was, that option was
Okay.
meant to be for.
Okay, I hadn't noticed that when I put a
I thought
new,
that was the updated terminology that they use
Yeah.
with ACM.
yeah, I hadn't noticed that in the list. So thank you.
You're welcome. And never
Yeah, thank
hesitate to reach out with questions like that as they come up and you're not sure how to, which option to select, just ask.
Yeah, Casey, there was another question in the chat in regards to referral source. What would be the best location for public admins?
For referral source. Let's look at that when we get into care manager and look at those options. Can you hold that? And then we can look at all the options together. And then we separated out the community referrals. And so this is also multiple selections will be allowed, but it's not a required field. So if you're only making behavioral health referrals and not community referrals, you don't have to select anything in this. But generally you probably are doing some, have some sort of referral under there. It's just remaining optional. Okay, so I'm gonna stop sharing so I can move over to care manager. Can everyone see that okay? Move some stuff around here. Okay. So once you are logged into care manager, you want to make sure that the client that you've received a referral on is in care manager or is not in care manager. So the first thing you're going to do is search for that client. And there's several ways that you can do that. There is a search bar here where you can enter the name. You can add a new client and then search. We'll look at that in a minute. And then you can search here in this search bar. And just as a reminder, this is a, what do they call it again, Tara, James? A dynamic search, right? Dynamic search. So it is search as you start typing letters, it is already searching. And so just to show you, I just enter a few letters and several options come up. So this is where I know you are generally working very quickly and entering your information, but this is where you just need to slow down just a little bit to allow the system to do the search for the name. Otherwise, you might miss it. Because as you see, you could start typing and you see things come up, but then they may, oh, it went away. I saw him, but then he went away. So just making sure that you allow that system to search as it's meant to do. And you can, we recommend that you just enter a few letters of the last name, comma, and then a few letters of the first name. And I'm going to search for Chandler Bing. And we can see that there's actually 2 Chandler Bings in the system. And so this is where you go, okay, well, which one is mine? Well, they have the same birth date. So, but one of them has a DCN. And this is the one you will, if there is an option with a DCN, that's the one you want to select. So select Chandler. I'll give it a second for it to pull the information up. You can see his information comes up here. Yes, confirm, that is all the right person. And then you go over to the left-hand side, and I am in the training environment for Care Manager, so there is no PHI that I am sharing. And also in your Care Manager, you will not see this option, CMHL referral report. That's gone away. But you can go down and select Liaison Referral Report. And I see that Chandler has already had several referrals. And this is good for you to know when you get a referral on someone to look and see if there's already a liaison working with that individual or recently worked with that individual. And we can see that there was a referral with Chandler as recent as June 30th of 2022. And so we want to go over here and view that referral, just to check out what happened, what's going on, any resources and services that were referred. And, you know, you could even reach out to whoever that CBHL is, where their name should be in this field. It's missing here, but you can always look up here and say, okay, James updated this on June 30th. So I'm going to call James and talk to him about Chandler and find out what's going on with him. Just to, you know, reduce any duplication of efforts. And again, reminder of Care Manager is your care coordination tool. And so you're coordinating care for that individual with, whether that's with another liaison or with whatever agency they're already engaged in. And so you can also go down and look at notes. If James entered any notes, it would be down here and you can see maybe what's going on. This is why it's really important to keep your data entry in, as up to date as possible. Just so when these situations happen, if I come along, then I know that what James has already entered and in here and what he's already done with Chandler, and that helps me be able to work with Chandler as well. So we're going to back out of that. We're not going to do a new referral on Chandler. I actually received a referral on Nancy Wheeler. Any Stranger Things fans? Okay, yeah. Yay. So I got a referral on Nancy. So I'm going to search for her. And again, just entering a few letters, we can see some names start to come up. I'm going to put in NAN. It says no results found. You can go ahead and type out the name if you want to just make sure that she's not in there, not seeing her. So then you can go up to add new client and then enter the name again, and it will actually search again once you enter the name here. Again, confirming Nancy's not in Care Manager. So we're going to add a new client. And if anyone has any questions, just interrupt. So this is where we enter the demographics. You see the name here, and you can, if you have not capitalized or you see a misspelling, a typo, you can always change it here. And then even if down the road you're looking at your referral and you go, oh, Nancy spelled IE or something like that, then you can always come back and edit the demographics to update that name and ensure the correct spelling. So enter as much information as you know to identify the client. If you know the middle name, she's Nancy May. We know her gender is female. Date of birth is required to enter a new client and to save that new client in Care Manager. And I know several of you, we've had discussions that has been a challenge in a few cases, that you don't always get the date of birth. And so then you can't add a new client into the system. So just do, if you don't get the date of birth with the initial referral, ask the referral source if they've had any other contact with that individual. Maybe they can search through their system, searching your EHR, Seymour, anything to try to locate that individual's date of birth. And if not, you may just have to wait till you make contact with that individual, and hopefully you can. If, I know there's extreme cases where you don't make contact, you've tried all of your, resources to locate a date of birth, and there's just not one out there, you may not be able to enter this referral in Care Manager. I know there are some extreme cases like that, but just doing your due diligence to try to find it so you can get counted for that referral is best. So here for the date of birth, we'll go ahead and enter birth date, or you can use the calendar here. It will auto-populate the age automatically. Social and DCN is not required, but if you have those, it is very, very, very helpful. And I think Mel and Katerina are on from DMH if they want to emphasize the importance of being able to get that data to be able to match that individual with other data feeds in the future.
Yeah, I can speak to it. It's really important. You would be surprised how many people we as a system of care see who have the same first name, same last name, same middle initial, and were born on the same day. And they would be multiple people who we will treat as one. So in order to avoid that, social security number or DCN or both is really works miracles for us when we need to identify these people as our consumers. So if you have that data available, please, please, please enter it in the system.
Thank you. I appreciate that, Katrina. And as Tara said, include as many identifiers as you can. And you can always come back and edit this. So if you don't have it at the time you're entering, come back and edit it later when you get these identifiers. Anything in here that you can add, you have the option, driver's license number, if you have that, which that you may be able to get that through, if it's a law enforcement referral, they may have access to that. And then any aliases, like for instance, my name is Crystal, but I go by Casey. So that would be helpful to enter into this form. And then any other addresses, phone you want to enter. It's not required, but you can enter that there. Under the demographic survey, these fields over here, they are not required, and many of them you're going to be entering on the referral form. So you're welcome to enter it there, but you're not. It's not necessary. So once you have all the information entered on the demographics, we can save. Oh, sorry, I didn't click out of that, did I? I don't want that. Once you open that up, it's required. There. Okay, so once you save the demographics, then we come up with the episode detail. So here is your episode type. It will always for you be CMHL. Now we may update that. We didn't get that updated in this round, but that may be updated in the future. Either way, it's always going to be CMHL, or maybe in the future it would say something like CBHL or liaison. We'll let you know if ever that changes. For now, CMHL. Your agency, I'll say I'm with BJC. The assignment date is the referral date. So if you're entering today as the referral date, then you'll enter today as the assignment date. And then client status, we do not enroll. It will always be outreach for your referrals that you receive. Any questions on the episode detail once you enter here? So we save that. We can double check, make sure everything is good. You have the edit button if you need to make any changes to the demographics. Once you have that entered, you're ready to enter your referral. So go down to Liaison Referral Report. And obviously there's no previous referrals on this individual because they are a new client. So we select New Liaison Referral Report. And if I'm going too fast, just say something. I'm just going to roll through some of these options very quickly. Your BJC or your agency, here's where you enter your name. My name is not in here, so I'm going to be James. So you can enter, just start typing the first couple letters of your name. It'll pop up. Then you select your name. If you're a youth liaison, please check the box. And then the date that you received the referral. And then the date of first attempted contact. So I tried to call this Nancy today. So today is my first attempted contact. Here is the date of actual contact. So once you make that actual contact, then you can come back and enter it there. It's not required to save the field at this point. Name, date of birth, DCN, social will all auto-populate for you. So you can, you don't have to enter anything there. If the individual is passed away before you are able to receive the referral or even attempted contact with the individual, here is where you will select that as deceased and the information about their death. And we do want to make sure that we get that if it was an overdose or a suicide, that you are selecting that information on their death. County of referral, this is what I was talking about earlier, where you received the referral from. So the individual lives in St. Louis County, but the referral actually came from City of St. Louis. So you would indicate that here. St. Louis City. And the race, ethnicity, and gender, this may come to you through the referral form, and that's okay, but we ask that you make sure that that is how that individual identifies and never assume what their race, ethnicity, or gender is based on what you observe or what you see. Always ask how they identify. If they are female, oh, she is female, sorry. If they are female, you will select over here if they were pregnant at the time of the referral. Nancy is not pregnant, so we'll mark that no. Employment, housing, these are all pretty self-explanatory, and I don't think anything changed on employment or housing. I do want to say, just make a note, homeless versus unstable housing. So homeless, they are truly homeless and have no place to stay. Unstable housing could be that they're staying with friends, family. Couch surfing is the example that we have in here, but they have a place to stay, but it's not their permanent residence, and they are just a guest at that location. Insurance status, this is what changed from payment source to insurance status, which it's really just references it more appropriately than saying payment. Say she's uninsured. Justice involvement, this is where we added the pending charges / trial. And if you are a youth liaison and they have just juvenile office involvement, you can select that here. If they are involved in treatment court, including juvenile treatment court, we added that. If they have a diagnosis, DD diagnosis. Military status, again, it's all in how you ask them, making sure that you're not asking if they're a veteran, but maybe if they have ever served in the military. And sometimes this may come to you through the referral source too. If they are prior military or they're a veteran, then you could indicate here the VA engagement. Primary referral reason.
Casey,
Yes,
sorry to
sir.
interrupt.
No, go ahead.
I ran into something that I didn't think I would. I asked the military question and they said yes. And we got to talking. They were a contractor. They were never former military.
Mm.
So it's just FYI, keep an eye out for that. We're going to see more and more of it.
Thank you. That's a good thing to know. Anyone else have anything? So primary referral reason, primary mental health history, what you know. If you don't know it at the time that you enter this, please go back and update it as you do know. Alcohol or substance use history. And here, this is optional, but if the referral came to you due to an overdose and they survived, then you would indicate that here. And we do want to make sure that we're collecting that information. If they're receiving mental health, substance use, co-occurring treatment at the time of the referral. So this is where the services referred changed. So we have behavioral health referrals, which is a required field, and you are allowed to select multiple options. And you can also, at the very bottom, we just this past week added transferred to another liaison. So if you get, no matter who gets this referral, whether you're a CBHL or youth liaison, if you transfer it to another liaison after you've done some work on it, then you will indicate that here. Or if you referred them to a crisis stabilization or behavioral health crisis center. So you can see as you select multiple options, they will all show up here. The date that you referred them to the services. And again, just to point out, this will help us track that timeline and tell a better picture about what the work that you're doing with the individual once they get referred to services and once they get engaged in services. And so, several years from now, it'll really help us to show that timeline and the work and solidify the work that you're actually doing by telling that picture or showing that picture down the road. And then community referrals, again, you can select multiple options and they will all show up here. If it was a CIT report that came to you, you will indicate that here. For the youth liaisons, most of yours will not be CIT reports. So you will more than likely always mark that as no. And this is where, for those in the city of St. Louis, if this came to you from BHR, you would check that box there and then put the referral source over here. I'm going to say that this was Sheriff's Department, however, and it was Jefferson County. And then any notes you want to put down here. This is not meant to be like what you would enter into your EHR or, official client record. This is just for care coordination. So keep your notes at a minimum of what you would want someone else to know about that referral and what you did. You could indicate that there were maybe multiple contacts attempted, but never could locate the individual if that's the case. Or you could have multiple contacts with that individual for, going on for a while. We could talk about that, but just keep those notes at a minimum. And then at the bottom is where we have the youth liaison options to enter. So if you, for the CBHLs, you can just leave this. They are not required fields. You can save your form as it is and not enter anything else. For those that are youth liaisons, we will want you to enter this information. If, their education level, if they were in an alternative school or homeschooled, you would indicate that here. And then their living arrangement, if they are living with parents or family, or if they're in foster care, or if they're in state custody, we've got that separated out here. And then any notes regarding their DD diagnosis. Okay, we had a question about the referral source earlier, correct?
Yes. The question was, what would be the best location for public admin?
Public administrator. Anyone what out there using that now? What option are you using?
Other.
Other?
I didn't realize we took referrals
Other.
from anyone other than law enforcement and courts for the CBHLs. So is
Say that
public
again,
administrator
Peggy.
considered the court?
You're saying that they could be court?
I mean, would that be considered? I don't typically take referrals from the public administrator.
Okay.
I more refer to them, but but I would assume it would be courts. But like I said, we have historically only taken referrals from law enforcement and courts. So I don't know how that would fit in.
So we, North Central, we use our public administrator quite frequently, back and forth. And I've always just used, because they're part of our probate courts. It's kind of is how I've been putting them in.
I think that's fair. Other or probate court. Probate court, I think, makes more sense. And you can always then change that here to Jeff Coe, public administrator, to specify where you got it from. And that's the benefit of having that field there, is that you can be more specific if you need to be.
So I have Casey, I have a question. When you're putting in, now that you can like put in the specific agency, so like I do data, like year-end data. So like next year when I'm doing data for this year, will I be able to go back and like populate and say, okay, 50 of my referrals have come from this particular agency and 10 have come from this particular agency? Or is it just going to be like, no, you have 100 from the probate court?
Tara or James, will that show up in the new reports that they pull?
Yeah, it includes every field available, the reports do. Now,
Okay.
just keep in mind, we've asked you all if you need a report built, because it takes a significant amount of time to build those reports. We've asked if you know you want a report, just to send us an email through the help desk so we can build those for you.
Okay.
Thank you. Those are good questions. Any other questions while we're looking at the form? I will say you're always going to have those odd situations or circumstances that come up. And again, don't hesitate to reach out and ask, you know, and we can talk through the best way to report that.
Casey, I see one more question in the chat. Should I put public defender referrals in a criminal court or other?
Oh, we just started that conversation with public defenders earlier this week. Or state agents, would it be considered a state agency? Any thoughts on that? Has anybody received referrals from a public defender?
We do at North Central as well. And I've been using criminal court because they have told us that that is majority of their cases is on the criminal side.
Yeah.
I did the same thing and I added under court.
Okay.
Thank you. Because that's what I was going to say, because I get a bunch of them, and they're the public defenders that I've been mainly working with are to the counties in my catchment area. So like, you know, like a Howe County public defender will give me so many referrals, and specific to just, you know, like, so it's like my county. So yeah, I know they're a state agency, but I'll start putting them as criminal court if that works.
Is that fair to everyone? Is that a consensus? See a few heads. Okay, cool. Good questions, good discussion. I appreciate it. So once you've completed your form, you've entered everything as much as you know. You do have, any field that with a red asterisk is required. So if you're entering this form, if you're filling it out, early on, which we ask that you do, and you don't have all of the information, it's okay to select unknown. But please go back as you gather more information to update those unknowns. We, it's really not good data to pass along to our state legislators, to our state leaders, the governor's office, when we say, when we have a report that something is a high number of unknowns. So as best that you can, please go back and update the information and resave it so that we have that. So you can save and close and it'll take you back, or you just hit save. And I will show you, you'll see who created it and who updated it. So you cannot, even see, if you created it and then 2 weeks from now, you go back and you update this form, it'll show that date that you updated it, 7/27 or whatever it was. And then you can go back and then you'll see your referral there. And if you want to view it, you just click on that and then you can edit it as you get more information. I don't have it in my training environment, but the reports are available. I'm going to go back for just a minute. Let me stop sharing and I'll share these documents with you. The user guide will walk you through. If you are not familiar with how to access your reports, it will walk you through that. Can everyone see the user guide here? Okay. At the end, it'll take you through all the steps that we just went through with the form. And then at the end, I'm almost there, accessing a report of your referrals. So at the top of your care manager, you'll see reports, you'll select self-service version 2, and then select shared with me, and then options will come up for those reports. As Tara said, with the new form changes, if you've previously been using reports and you want to continue to use reports, which we highly recommend, then you need to send an email to the Care Manager Help Desk and let them know which reports you need. So those can be built out with the new fields. We just ran into this earlier this week. We had a supervisor accessing the old report, and so it wasn't showing the new fields that had been entered, in particular the services referred. And so it was missing that information and data. Any questions about that? Good.
There was an additional question in the chat, Casey.
Okay.
What do you do if you notice that there are duplicates in Care Manager?
Oh, very good question. If you notice that there are duplicates, or you have accidentally added a new client that was already in there and you don't realize it till after, please email the Care Manager Help Desk and let them know those identifiers, again, in an encrypted email. So we're not sending any PHI, and they will get that corrected for you. Just to go through a few reminders, searching for clients, make sure that and that kind of goes back to the talking about the duplicates, making sure that there's no duplicates in the system. Allow the system to search as you type the name into the search bar. If there is more than one account for that individual, please select the one with the DCN. That would show that that came over from DMH. So we would know that that's the most accurate report. If there are transfers between liaisons, you receive a referral from another liaison, you will start a new referral for yourself on that client. You would, if the previous liaison had already entered a referral, you do not go into that same referral and edit their information. That is their referral, and then you will be counted as your referral too. So everyone receives proper credit. If you receive a referral and you know immediately it needs to go to someone else, whether that's another CBHL or to the youth liaison now, and you don't do any work on it, you just call them, say, hey, I've got this referral, you give it to them. You don't have to enter anything into Care Manager. There's no need because you didn't do any work on it. If you do any work on it, please enter it so you have that referral credit. Entering your data as soon as you can after receiving the referral is very much appreciated and recommended. And you can, again, go back and update the information as you receive it. Try to limit the use of the unknown option, like we said, and just a reminder about the notes section. It's a care coordination tool, so just the very minimum information needed to coordinate care with other liaisons or other agencies. And again, the Care Manager Help Desk email if you have run into any issues, run into any technical issues, or need help with anything in Care Manager. You can use that email, and remember, if you're sending PHI, that you use encrypted email. All right. Did I miss anything that you had hoped to cover or have any additional questions? Oh, I saw something pop up now. Repeat contacts with someone in jail. Person is out, then back in very quickly. Is that a new referral? Kim, do you mind explaining a little more? Is it for the same situation? Different situation with a wheel?
Sorry, it's a week, within a week or so. Like he ORs out, but then doesn't show up for court, and so they're back in there.
And you get another referral from?
Jail.
I don't know, has this happened with anyone else?
We would treat that as a new referral.
Okay.
We treat it as if it's a follow-up, obviously we don't, but if it's whether it's a law enforcement referral or a referral from jail, if it's a new situation, even if it's the next day and we've had any outreach in between that, then we treat it as a new referral. I'm not sure what everybody else does. That's what we do.
Well, I have a question on that one. If I get a referral from jail, I go and visit them, and then we find out that another charge hits and they're going to be sitting for a week or a month or two, I will use the same referral to follow up with them closer to court, following court, things like that. Should I be adding a new one for that?
I think for that situation, it's continuing on the same issue that brought the referral to your attention.
Okay.
And in what Kim and Peggy were talking about, it's a new, something else has happened, you know, in the meantime, and that prompted a new referral.
Excellent, thank you.
Mm-hmm. Anyone else have anything? All right, well, I really appreciate the interaction, the questions. It's been great. I appreciate everything that each of you do on a daily basis. And if there's anything that we can help support you with, or you have questions as they come up, you never hesitate to reach out.
Casey, if I can just jump in, if you're a youth behavioral health liaison on this call and haven't reached out to me, I will put my email address in the chat. And if you could please send me an email, that would be great. And then just another general reminder, 988 is going live this Saturday. So that's very exciting. I hope that the launch goes well for everybody and their providers.
Thank you.
Thank you, ladies.
Thank you. Have a great weekend, everyone. And Michaela, just put her email in the chat if you need that.
Thanks.
See you soon.